All right. Good morning, everyone, and welcome to the University of Western States' first ever virtual version of Chiropractic Preview Day. My name is Josh Civiello, and I'm the Executive Director of Admissions here at UWS, and it's my happy task to help us get started here today. We've got some great presentations planned for you over the next couple of hours. Chiropractic instructors, clinicians, current students, and recent alumni are all going to share their experience and expertise. But before I turn presentation duties over to their more capable hands, there's a couple of topics I want to address. First, I want to acknowledge the elephant in the room and talk a bit about how UWS is handling the disruptions caused by COVID-19. Personally, I think one of the more jarring aspects of the pandemic has been that it's caused so much uncertainty. Sometimes it's impossible to predict how the pandemic is going to impact our lives tomorrow, let alone what the world's going to look like 6 months from now. If you take only one thing from today's preview day, I want it to be this. It's that UWS has created a series of contingency plans to deal with whatever the world might look like over the course of the next year to ensure that both new and continuing chiropractic students can continue to get a rigorous and high quality education that prepares them for clinical practice. Our current plan and our hope is that new chiropractic students starting this fall will take all courses and labs in person on our Portland campus. But it's important for you to know that in the event that Oregon is still implementing COVID-19 related restrictions, or if there are significant travel restrictions in general, we're prepared to offer the full curriculum, both lectures and labs, in an online and virtual environment. A final decision hasn't been made yet, but please know that we're closely monitoring the situation and making plans to ensure that you don't have to delay your goals no matter what the world throws our way. The second thing I wanted to mention is that while we're thrilled to be able to speak with you from our homes, I'll admit that it's a little bit of a disappointment to not be able to host this event from our brand new campus here in Portland. In case you aren't yet aware, literally the week before the shutdown, UWS completed our campus move to a new location here in Portland. The best way I can describe the new campus is that it has bigger and better everything. Classrooms, adjustment labs, our integrative clinic, the library, all student space, study, relaxation, and exercise space. The whole campus has been designed to meet the current and future needs of our chiropractic students. Additionally, the classrooms and study spaces were designed with flexibility in mind, meaning that we can reconfigure classroom spaces to meet our instructional needs. With the onset of COVID-19 and social distancing practices, this flexibility has been incredibly helpful as we're working to redesign spaces to keep students safe while allowing them to continue their studies. We've got a video tour of the new space available on our website. You may have seen a bit of a snippet of that earlier. We're also going to email you a link to that video after today's event. But I also just want to say that once things return to some semblance of normal for us all, I implore you, please come visit us here in Portland and see just how amazing our new campus really is. All right, without further ado, please allow me to introduce you to today's MC, our Assistant Director of Recruitment, Natasha French. She's going to walk you through the ins and outs of today's events and give you some instructions on how to interact with and ask questions of our panelists. But thank you again for spending part of your Saturday with us today, and welcome to UWS.
Good morning and welcome again to our Spring Chiropractic Preview Day presentation. Thank you so much for joining us. My name is Natasha French and I am the Assistant Director of Admissions and International Student Advisor at the University of Western States. Our event today will include presentations from our chiropractic faculty, clinical faculty, student and alumni panel, and Office of Admissions. After each presentation, we'll leave about 5 minutes for questions. If you'd like to ask a question, simply click on the Q&A button at the bottom of the screen and then toggle to choose whether you'd like the question to include your name or be posted anonymously. We'll answer as many questions as the time allows and then respond to others via email to everyone who RSVP'd. I'm very excited to introduce our first presenter, Dr. Lester Partna, who will be speaking about the history of chiropractic. Dr. Partna graduated from Western States Chiropractic College in 1989 before it became known as the University of Western States. He began teaching part-time at UWS in 1994 and continued practicing in Portland until 2008. Over the course of several years, he transitioned to full-time faculty status, and now he currently teaches courses in surface anatomy, biomechanics, chiropractic theories, and adjustive technique. He's frequently been involved in university-sponsored research projects, Office of Admissions events, and student-sponsored events on campus as DJ Dr. Partna. That said, please help me in welcoming our first speaker, Dr. Lester Partna.
Thank you very much. I am going to share my screen and launch right into the presentation. So good morning. To start, I'll tell you a quick story, and that story was something like this. Oh, first I forgot this part. Me. When I was about 16 years old, my mom had a really bad episode of low back pain. And it went through avenues of her low back pain. She went to her MD, physical therapist. Her low back pain persisted, and the normal things that people have done for low back pain just didn't seem to be working. And then finally, she got her advice. She went to a chiropractor, and I was able to go to her that day and see stuff that's what started my interest. The chiropractor was able to help her when the other, more traditional methods had not been helping her. And what I thought was most interesting was that he was able to offer that kind of relief with very low-tech means. This doctor used his hands, and I thought that was something really incredible. Since that time, since I've been a chiropractor for so many years now, I've witnessed similar things in my practice thousands upon thousands of times. I've never been. People come in, they've got pain. A lot of the time it's low back pain, like my mom had. And then the chiropractor will push and pull and twist and turn various things with the patient, and they end up walking out feeling better than when they came in. I refer to this as the chiropractic equation. Now, of course, it's not always this simple. Cases can be complex than this, but this happens so frequently that we tend to take it for granted as chiropractors. We see it all the time. And when I was a teenager, and I was 16 years old, the thing that amazed me the most about the interaction was that the doctor was able to produce that effect with nothing more than the hands. And I think that's still one of the things that is most appealing to me about being a chiropractor. Now, in order to understand where chiropractic is positioned in the world of healthcare these days, and where the University of Western States is positioned in the educational world, I start at the beginning and give you a little bit of a history lesson on chiropractic. Chiropractic started in 1895. D. Palmer was one. His full name is Daniel David Palmer. And we refer to him as the founder of chiropractic because it was his idea. He based chiropractic on a single proposition, the idea of the subluxation. Now, he defined a subluxation as a misaligned vertebra in your spine that pinches those little nerves that exit the spine and go out and supply all of the other bodily organs and tissues. Therefore, he reasoned, if you have a misaligned vertebra and it pinched one of those nerves, it could interrupt the nerve supply going to those organs and tissues and become disease. So you could have heart problems because you had a subluxation in your spine. You could have stomach problems because your spine was out of alignment. His idea, therefore, was a chiropractor would push those bones back into normal alignment using what he called an adjustment. By the way, we still call them that. But realign those vertebrae so the nerves would be pinched. And then the body would heal itself because of its inborn healing abilities. Now, D.D. Palmer had a son named D.J. Palmer, Bartlett Palmer. He's probably the most famous chiropractor there has ever been, and referred to as the developer of chiropractic. He was a very interesting man with some very unique ideas. One of them was this. He was even more adamant than his father that subluxations caused diseases. As a matter of fact, he believed in what he called the monocausal theory of disease, which is to say there is only one cause of disease, subluxations. Subluxations cause all these diseases. It didn't matter whether you had a cold or kidney stones or muscle spasms. It was all caused because subluxation was out of alignment. Now, therefore, like his father, but even more so, he believed that by adjusting the subluxation, you were removing the cause of any disease that you have. Well, here's that. Early in the 1900s, when the profession was still in its infancy, the profession divided into essentially two groups. So back in the very beginnings of chiropractic, this divide still exists. I'll get a little bit more into this as we go through this. But here's what it looked like. On one half of the chiropractic spectrum, we had what we will call traditional chiropractors. On the other side, we have what we will call modern chiropractors. These aren't official names, but they serve to make the point. Traditional chiropractors were those that stuck to the original concept, those who followed the principles that the Palmers had taught. But because this version of chiropractic was not guided by the collection of data or the performing of research, but it was based on an idea, this type of chiropractic could be viewed as belief-based chiropractic. Now, the modern group, let's just call these the rebels. They were rebelling against this more traditional version of chiropractic. And what happened was this. They were looking at what was going on in the world of medicine at the time. In the world of medicine, they were now doing research, their ideas. Now, some of their ideas just weren't all that good, and needed to dump them. Others of their ideas showed more promise, and as they would test, they would come up with more and more evidence about which treatments work best, which diagnoses or which diagnostic tools work the best. So this group of chiropractors saw this going on and essentially said, we should use this same method in guiding the development of chiropractic as a profession. For this reason, this type of chiropractic could be viewed as evidence-based. And in today's world of chiropractic, this is what we call it, evidence-based chiropractic. So even though this happened back in the early 1900s, these two groups still exist in the chiropractic world. All chiropractors more closely associated with one or the other of these two groups. Not only that, but all of the chiropractic schools more closely align themselves with one of these two groups. Now, let me go into a little bit more detail about what this looks like in real life, what it means now. So on the left side, we have more traditional chiropractors. On the side, we have more modern chiropractors. On the traditional side, the view would be this. Subluxations cause interference to your nervous system in a way that can affect your health. No chiropractors believe in the modern disease anymore. That's dead because to defend these days. That just does not support that. Our traditional chiropractors nowadays are more likely to say something what I have written here. Subluxation interferes with your nervous system in a way that can affect your health. This is referred to as the TPS, which stands for Traditional Palmarian Subluxation. Let's see. If my video is cutting out now and then, I'm not aware of when that's happening. So what we need to do is, you might tell me what you go for this. Now, the TPS, something that traditional chiropractors would have more of an affinity for, the traditional Palmarian subluxation. Modern evidence-based chiropractors reject the traditional Palmarian subluxation. Modern chiropractors don't use the term subluxation anymore. And if they do use it, they mean something very different by it. What they mean is a local biomechanical lesion of your spine. Maybe you've got a muscle spasm that's inhibiting the motion in your spine, a more mainstream diagnostic type of thought. And some modern chiropractors will use the term subluxation to describe that. Traditional chiropractors, since they believe that subluxations have a negative impact on your health, they are more likely to encourage their patients to have ongoing maintenance chiropractic care. In other words, if you come in and see me regularly as a chiropractor, you will be happier all around. You'll be healthier, you'll run faster, you'll play golf better. All the things you like to do will be better if you don't have subluxations. Therefore, it's a good idea to come in for regular subluxation correction. Modern chiropractors would probably say, that's a really great idea, and if there was any evidence, come in. But there isn't any right now, so I'm not going to base my practice on that premise. What I will do is, if you have a condition that I am skilled at treating, that's within my scope of practice, I will treat that condition. And when I'm done treating that condition, I'll look by and say, next time you have a condition that I can help you with, let me know. Give me a call. But I'm going to use limited care that's condition-based rather than ongoing care of subluxations. Traditional chiropractors focus on their ability to find subluxations as their most important diagnostic skill, since they will be treating mostly subluxations, if not exclusively subluxations. Modern chiropractors think about it differently, since they don't regard subluxation as the cause of or even an influencer of their overall health. They believe comprehensive diagnostic skills are necessary. Do I need to listen to your heart? I need to be able to figure out what's wrong with you so that I can apply a more evidence-based approach to your care. Traditional chiropractors focus on the adjustment. Sometimes traditional only treatment. Use many different kinds of treatment, hopefully the best that evidence has to offer, customizing the treatment to the patient's condition. If I were to summarize this whole chart, everything that I've said so far, it would go like this. And it kind of goes to this question. How would you ever know if a chiropractor is on one side or the other of the spectrum? Yeah, that's pretty simple. You can always ask them this. Are you a subluxation-based chiropractor? If they say yes, they're very likely to be traditional subluxation-based in the way that they practice. Whereas a modern chiropractor, if you were to ask them, are you a subluxation-based chiropractor, they'd probably say either, no, I'm not. I treat whatever condition you happen to have using the best, most evidence-based methods available. The other thing I'd say, if they're an chiropractor, by subluxation, they have a different version of that nowadays. If they're looking at the well, I treat okay. Hopefully that made sense. The way that chiropractors are viewed by the public has changed dramatically during my lifetime as a chiropractor. I've been a chiropractor now for 30 years, and it has changed since I graduated in the days when I was a teenager, and my mom was kind of hesitant to go to the chiropractor until she was talked into it by one of her friends. If you were to ask the general, would likely say, that's quackery. Chiropractors are quacks. They're not real doctors. Their training doesn't equal that of any other kind of healthcare. It's more like voodoo. People would say stuff like that. It's quackery. It's hucksterism. But over time, especially in the last decades, things have changed a lot. We started to be considered as alternative healthcare providers. And later into the 90s, complementary healthcare. Oh, this is moving into a more mainstream terminology now. Nowadays, we're very likely to hear chiropractors spoken of as being integrative health. You see, it's a long way from quackery to integrative. The public sees us differently. And I would argue the biggest factor that influence that perception has been the fact that we have been collecting data, doing research, collecting evidence to show what are we good at treating, what does the research support. Also importantly, what are we not good at treating? What are things that we really shouldn't be treating? Research has been very helpful in pointing these things out, to the point where in recent years people are writing about the methods that we use based on the results of systematic reviews of randomized clinical trials and evidence-based clinical guidelines. Spinal manipulation / mobilization is effective in adults for acute, subacute, and chronic low back pain, migraine and cervicogenic headache, cervicogenic dizziness, several extremity joint conditions, and acute / pain. By the way, this represents most of the things that people go to chiropractors for. We have non-chiropractic researchers writing things like, there is now little dispute amongst knowledgeable scientists that manipulation is of value in the management of been using for years have been found to be effective in some patients that are in some conditions that patients commonly will seek chiropractic care for. All of this is to illustrate that in the past several decades, chiropractic has become much more mainstream, I might add, evidence-based chiropractic. Now, moving on. History right now. What's the University of Western States? First of all, we are a science and evidence-based chiropractic education institution on the modern side of chiropractic. As a matter of fact, Western is the most evidence-based of all of the chiropractic schools. Our graduates are portal of entry physicians with the conditions. Now, what this means, just in case you've not heard this terminology before, portal of entry in the chiropractic world means, but in the healthcare world, portal of entry means patients don't need a referral from another type of provider to see me as a chiropractor. They can come straight in off the street and I can be their managing physician. Range of conditions. We do have a primary area of focus, and that is the area for which most people seek our help, and that is the area of musculoskeletal conditions or even neuromusculoskeletal conditions. So I like to think of this as orthopedic conditions. Now, when you think of orthopedics, think of the body's structure. Bones, joints, muscles, ligaments, tendons, all of those things are orthopedic type of structures. I like to think of it very simply like this. Most of what chiropractors treat goes into the category of pain. These are orthopedic conditions, and one of the great things about being a chiropractor is there is no shortage of these types of conditions. People will probably be having them forever. Our emphasis, our strengths, include manual treatments, meaning hands-on to spinal manipulation. That's just what we're famous for. I like to look at it this way. Modern evidence-based chiropractors are care orthopedics experts. Now, what that means is I treat mostly orthopedic conditions, aches and pains, and non-surgical. As a matter of fact, you may not know this. The word chiropractic is itself a of jobs. It's a hands-on type of therapy, which is so interesting in a day when we hear so much about the opioid crisis. Of course, now we're this, right? From wonder drug to abuse epidemic. But a couple of years ago, it was in 2017, 3 years ago, the American College of Physicians actually revised their recommendations for treating low back pain based on current evidence. I got this little video clip from a news website, and I want to play that for you.
In new recommendations out today, the American College of Physicians says patients should treat low back pain with non-drug therapy first. That means things like yoga, massage, spinal manipulation, acupuncture.
That's what the evidence is saying today, that manipulation is one of those conservative care therapies that should be applied before drugs are tried for things like, well, in this case, specifically for low back pain. At the University of Western States, we prepare our graduates to function competently and in an integrated healthcare environment, working with all different kinds of healthcare professionals, each contributing their unique expertise for the Now, the next thing I want to talk about is diagnostic tools. What are the diagnostic tools used by modern evidence-based chiropractors? A lot of people are surprised to find out that we if I need to listen to somebody's lungs, I'll use a stethoscope. If I need to check their reflexes, I use a reflex hammer. If I need to look in their ears, I use an otoscope. Let's see, somebody says, I am not being heard right now. I don't know if it's cutting in and out or you can't hear me at all. Let me do a quick test. Check 1, 2, testing. Okay, it looks like it sounds okay now. Okay. Other things that we use diagnostically, we can do lab tests if we need to, draw blood, do urinalysis. We're trained to do the tests and interpret the test. If the patient needs x-rays due to an injury or trauma or whatever the necessary case may be, we read x-rays. If they need more sophisticated imaging, we can order those at the local hospital or radiology clinic. But what really differentiates us from other healthcare providers is the degree to which we use our hands, both in the diagnostic process and in the treatment process. After all, it is chiropractic, which equals done by hand. The next thing I want to mention is this. What are the treatment tools used by modern chiropractors? I think you already know what some of these are going to be. Manual therapy, especially adjustments at the top of the list, is probably what we're most famous for. Though nowadays you might hear chiropractors refer to it as manipulation, especially evidence-based chiropractors, as often as they will use the term adjustment. But we also do other manual therapies like mobilization. And if you recall from those research papers that I had referenced earlier, manipulation and mobilization both now share strong evidence for treating many of the musculoskeletal things that chiropractors treat. Now, if you're not familiar with the difference, I want to demonstrate this for you. So for an example, a manipulation is something like this. I'm going to do a manipulation on this knuckle right here. I actually have a thing going on in this finger that could actually use one. A manipulation, that is. What I'm going to do is take that joint to the end of its range of motion and give it a little bit of a tug. I gave it a thrust. And as I did, I don't know if you could hear this in the microphone, it made a little popping sound, which we call a cavitation. Now that is a manipulation. I take the joint to the end of its range of motion and I give it a thrust. I gave it a pull. A mobilization, on the other hand, would look like this. I would take that joint to the end of its range of motion, and then I would rhythmically and repetitively stretch that joint. So it's more of a repetitive motion rather than a single thrust. As a matter of fact, the evidence in the last 10 to 15 years has really pointed to mobilization as being a very effective tool, in many cases as effective as adjustments for certain joint conditions. So modern evidence-based chiropractors are using more mobilization than they ever have in their practices before, in combination with manipulation. We also do a lot of soft tissue manipulation and massage, or in many cases, we hire other people to do that for us. Many chiropractors utilize the services of massage therapists in their practices. Now, other things that we do. Oh, and first, I want to mention this. When it comes to adjustive technique instruction at Western States, it's going to be different than it would be if you went to a more traditional school. As a matter of fact, this difference is something that you would find between any of the more evidence-based schools and any of the more traditional schools. In more traditional chiropractic schools, adjustive technique is generally taught using a systems approach. There are numerous chiropractic methods with names like Gonstead, Activator, Applied Kinesiology, NUCA. There are hundreds of these things, these brand-named techniques within chiropractic. We don't teach those techniques at the University of Western States. Number one, they are not what we would refer to as being evidence-based. What we do is we borrow material from any area that makes sense and has evidence to back it up. So if there's a particular technique that has something really good in it, we will utilize that portion of that technique. I like to refer to this sometimes as we steal from the best, from all sources, whatever sources we can. If it makes sense, if it has research to back it up, if it has a long track record of success among a broad cross-section of patients, that will help us to feel that it's strong enough to bring it into the curriculum. We teach adjusting by region rather than according to technique protocols, as they might do at more traditional schools. We have a thoracic adjusting class, or a series of them, a series of cervical adjusting classes, a series of lumbar adjusting classes, etc. What else do chiropractors do? We do a lot of exercise prescription and rehabilitation, especially as we learn more about how important that can be through the research. We can use orthoses, these things that help people's feet, for example, move biomechanically better to alleviate stress in the feet, knees, hips, even all the way up to the low back. The application of supports, taping, casting is all part of modern chiropractic training and practice. Physiotherapy modalities, which are all of the gadgetry things that people normally associate with a physical therapist, everything from ultrasound to muscle stim to hot and cold to laser. All of these things are things that chiropractors we use to treat people. Diet and nutrition counseling is something that we are well trained in and use frequently when needed. Ergonomic counseling, workplace design and modification, things like that are very important. Stress management counseling, especially as we learn more about how our emotional well-being can enhance our physical well-being. Lifestyle changes and wellness care, in other words, teaching people how to avoid the aches and pains and sprains and strains and live in more healthy ways. And if the patient's condition does not match our area of expertise, we are trained to make an appropriate referral for more aggressive or invasive care when needed. Out at the Oregon coast, out at Tillamook, that's the Cape Mears Lighthouse, beautiful place. Now, I want to make sure that I mention, though our primary area of expertise is with musculoskeletal conditions, and that's mostly back pain, that's what most people seek us out for, we can treat a lot more than that, and we're trained to treat a lot more than that. Let me just give you an example. Turns out chiropractors treat a lot of headaches, and the evidence is building for our treatment of many types of headaches. That should not be surprising, because as it turns out, the research is revealing that most headaches, by far most headaches, are orthopedically based. Who better to treat them than conservative care orthopedics experts like chiropractors? Athletic injuries. Matter of fact, this is such a huge deal now. I think you'd find it very difficult to find a college, professional, or even high school team that is not employing or somehow utilizing the expertise of chiropractors, because the benefit of that has been so convincingly demonstrated for so many years now. As a matter of fact, this is such a big deal. We offer a separate Master's of Science degree in sports medicine, which can be earned concurrently while you're getting your Doctor of Chiropractic degree. And it's a very popular program here at Western States. There are even some types of earaches that a chiropractor can treat that don't necessitate the use of medications, using really very traditional old-fashioned remedies like certain types of oil that you might put in an ear until it calms down. Anyway, that can be fun to treat. Dizziness, especially the kind caused by neck injury, is something that we treat pretty regularly. We can even treat things like high blood pressure, but I won't treat it the way that B.J. Palmer did. B.J. Palmer, in his traditional chiropractic thinking, would have treated high blood pressure by adjusting the upper cervical spine to remove the subluxation that he believed would cause the high blood pressure. If I were treating high blood pressure as an evidence-based chiropractor, I would use predominantly lifestyle modification, dietary changes, weight loss, exercise, things that are known to help people to reduce blood pressure in many cases, and much, much more. I just want to make sure everybody knows that if you don't just want to be a back pain doctor as a chiropractor, you don't have to be. There are many things that we are trained to diagnose and treat. Now, just a few words about education, because I know our other people are going to talk more about admissions requirements. I just want to mention a few things. Currently, there are 18 private chiropractic institutions in the United States. It's a 4-year program. You spend your first 2 years predominantly in basic sciences like histology and gross anatomy and biochemistry. And your last 2 years, you spend predominantly in the clinical sciences like neuromusculoskeletal diagnosis, X-ray interpretation, cervical case management, that kind of thing. And you do a clinical internship during your 4th year. Our program can be completed in 3 years if you go through the summer quarters. Otherwise, if you take the summers off, it's a full 4-year program. I found this a few years ago. This study was done in 2014 where they combined different healthcare providers' educations. I thought this was interesting. And even more interesting was the fact that they used the University of Western States for the numbers for the chiropractic program. They used Yale Medical. The only thing that I don't like about this chart, and it's a little bit hard to interpret, is the PT down at the bottom, the physical therapy. They used the program at Queen's University in Ontario, which is a master's degree program, whereas most of the PT programs now are doctoral programs. So factor that in when you look at these charts. For most programs, the PT numbers would be bigger. But look at these numbers. For total educational hours, DCs, chiropractors, MDs, medical doctors, and DOs or osteopaths, we have very similar numbers of total hours of education. You will notice that chiropractors get fewer clinical hours, but there's a really good reason for that. The reason is we are dealing mostly with aches and pains and sprains and strains that are not of a life-threatening nature. We don't need to spend the time, as much time in clinics doing rounds looking at people with serious conditions, because we just don't generally treat that many of those. We learn about them, we get exposure to them, but that's not our focus. Our focus comes into play here in a second. If you look at anatomy training, look at this. I'm a little bit curious as to why chiropractors and osteopaths, at least in this paper, got essentially twice the anatomy training that the MDs do. Physiology, this makes more sense. I guess it turns out if you're going to be a physician of any kind, you need to know how the body works. So physiology is equally important for all of those professions. Here's where it gets interesting. As I mentioned, chiropractors are conservative care orthopedics experts. We get a lot of training in orthopedics. Compare that to what they get in medical school, where that is not their main focus. For us, it is our main focus. This is why we're so good at it. A lot of training. Rehab and exercise, again, this makes perfect sense. This is what physical therapists do all day, every day. They should be the most well-trained on this. We get a fair amount of training on this because we do a fair amount of this. But MDs and DOs really don't get anything. That's just not their area of specialty. Now, of course, this is somewhat self-explanatory. This is what we're famous for. We're better at it than anybody. We get the most training in joint mobilization and manipulation. When it comes to pharmacology, again, PTs don't do any of that. MDs and DOs, that's what they do all day, every day. We don't. Therefore, we need a little bit of pharmacology training, enough to know what people are taking, what it does, how it interacts, and specifically how it might interplay with what we're doing with them. But it's, again, not our area of expertise, so we spend more time in the orthopedic world than we do in the pharmacology world. Now, I have one more short little section here at the end. Why would anybody want to be a chiropractor? And the fact that you're here listening to this illustrates you probably have some reasons why you thought about being a chiropractor. I might be able to add to your list. I've talked to a lot of students about this, and of course I have my own experience. I think there are some really good reasons why people should consider chiropractic as a profession. First of all, you can make a good living, and I think that's probably high on people's lists of their profession choosing matrix. I need to make a living. Well, how much do you make as a chiropractor? The numbers are kind of hard to come by, and it really depends who you ask, but here's some of the most recent numbers that I've come up with. Well, according to Chiropractic Economics magazine, and they put this together every year, they do a survey. Last year's survey said, across the United States anyway, the average chiropractic income was in the neighborhood of 123. That included things like salaries, bonuses, etc. JMPT actually did a study 2 years ago, and they said it was about 112. They estimated a little bit lower. Salary.com last year said it was a little higher, 149. I think no matter which of those numbers you take, that's a good living. Now, bear in mind, this does not represent what you're going to make the first couple years after you graduate. I don't know anybody who's made that much money the first couple years after they graduate. It takes a little bit of time to establish a running, ongoing practice, and that's when you start making a good living. This I found fascinating. 4 years ago now, MarketWatch said that chiropractic was the #1 of their top 10 professions for job security. It turns out, I was so surprised by that, I had to go read the article. It turns out there was really only one measurement they were making for job security, and it was the unemployment rate. Apparently, chiropractors have a very low unemployment rate. But really, when it all boils down to it, we all have different definitions of what financial success looks like. It's an individual thing. For me, can I get out and play golf on my favorite courses? Can I get out to the beautiful Oregon coast and fly my hang glider? If I can do the things that make me happy in my off time, I'm making a good living. And chiropractic has allowed me to do that for quite a number of years now. Now, with that as a backdrop, I want to talk about something else. What are some of the other reasons? Well, a lot of people say that chiropractic is a desirable lifestyle, and by that, people talk about several things. A lot of chiropractors, and you may have noticed this, after they've been in practice for a while, don't work a full 5-day week anymore. They trim it down to a 3.5 or a 4-day week because they can and still make the kind of money that they like to make. For some people, that means I get to spend more time doing the things I like. That may mean more time with my family or whatever the case may be. Most chiropractors run their own practice, which means they get to be their own boss and make their own schedule. And I think a lot of people find that very appealing. Here is a big one for me, and I think it's one of the things that I like best about being a chiropractor. As far as being a doctor goes, being a chiropractor is a low-pressure version of being a doctor. Here's what I mean. Most chiropractors work a regular schedule. I'm never on call. I don't have to worry about getting 3 a.m. phone calls telling me, Dr. Bartna, your patient's in the hospital, such and such is going on, we need you here now. That's not something that I have to deal with as a chiropractor. And frankly, I wouldn't like that. Some people are really good at that and love that kind of being needed. Not everybody has that kind of a personality. Here's something else that I really like. As I mentioned a little bit earlier, we're not dealing with extremely serious, life-threatening cases. Blood and guts, life and death, I'll leave that to other kinds of doctors. I like dealing with aches and pains and sprains and strains. I love that patient population. The procedures that we offer are very safe. Chiropractors don't hurt very many people. The benefits of this are not only it just feels like a lower pressure career, but my liability is lower. My malpractice insurance premiums are really cheap compared to other healthcare providers. That's because what we do is inherently safe. I think, though, here's what probably draws most people to chiropractic as a profession. We help people every day with non-invasive, low-tech, for the most part, hands-on treatments. We love that. And our daily work involves people coming in with their owies and they walk out feeling better than they came in. I think that is very rewarding as the provider of those services. And for these reasons, and probably a bunch more that I just haven't thought of, chiropractors are famous for their high job satisfaction rates. We really tend to like what we do. And I know that's been the case for me. And hopefully you'll find it to be the case for you if this is a direction that you decide to go. That is the end of my presentation, and I'm hoping that people have some questions.
Great. Thank you so much, Dr. Bartna. We have about 5 minutes if you'd like to ask Dr. Pardna a question. To post a question, simply click on the Q&A button at the bottom of the page and toggle to choose if you'd like to include your name or post the question anonymously. But to get us started, Dr. Pardna, what first inspired you to consider a career in chiropractic?
It very much has to do with that experience. At the very beginning, when my mom had that episode of really bad low back pain, and she'd gone to her medical doctor, and her medical doctor sent her to a physical therapist, and nothing was resolving that back pain. And when I saw her go into that chiropractor and 15 minutes later walk out just so much more freely than she walked in, that caught my attention. So that was the spark. From there, I really did a lot of investigating. But I'll tell you, by the time I went into my college years, I had already decided this is what I wanted to do. I went to college with pre-chiropractic courses in mind because I had decided. But it all stemmed from seeing what happened with my mom and then doing my own little my ongoing investigation of what kind of education was entailed and what I'd do as a chiropractor. No regrets.
Thank you, Dr. Pardna. Our next question, it looks like, do students learn how to adjust in the first term?
It's a great question, and the answer is no. And there are really good reasons for that. It takes a little time to get your hands on people regularly and learning the kinds of forces that you need. Not only that, being able to actually feel all of the landmarks that are necessary to feel before you can start to learn to do adjustments. Now, here's the way it works. The first quarter, you have a class called Surface Anatomy. I teach that class. It's one of my favorite classes. It's where we actually get your hands on people and you're feeling a lot of structure. Just getting used to that. In the second quarter, you have a class called Adjusted Skills.
And we're cutting out a little bit, Dr. Pardna.
Oh, sorry.
You might be moving too much.
Oh, sorry. What did we miss in that last part?
The second class.
Second quarter. In second quarter, okay, I'm going to keep my hands on my chair in case that's occupying too much bandwidth or something. In second quarter, you have a class called Adjustive Skills, and in that class, you learn things like adjustive impulses and correct body mechanics doing adjustments. And in that class, they also will start you out with a few adjustive setups to kind of warm you up to that idea. In your third quarter, that's when you have your first actual adjusting class, and it's the thoracic adjusting class. From there, it really doesn't end. Fourth quarter, pelvis adjusting, fifth quarter, lumbar adjusting, sixth quarter, cervical adjusting. But I don't think it would be a great idea for you to start adjusting in your first quarter. Experience has shown us that's a little too early. So third quarter, I think, sounds pretty many, many years of teaching this.
Yeah, and I can add to that we do have open adjusting labs that you can drop in on just to watch what other students are doing during first and second quarter, but you have to wait until third quarter to actually start practicing. Our next question from the audience is, are the choices of specialization within your curriculum, such as pediatrics?
Not within the curriculum. So, for example, we have a pediatrics class, and all chiropractors need to learn about kids and how to handle kids in practice. But it is not an area of specialization within the curriculum. As a matter of fact, I don't know that I could say that there are really any areas of specialization within the actual curriculum other than orthopedics, where we spend an awful lot of time. Now, if you have an area that you are interested in having as more of an emphasis when you practice, if you were to call it an area of specialization, generally that training is available after you graduate through various diplomate programs, continuing education programs, things like that. I guess the only correction to that would be the sports medicine avenue, which you can create an area of specialty if you do that master's program concurrently with the DC program.
Our next question, did you shadow any chiropractors before applying for DC school?
That's a great question. And the only chiropractor that I shadowed was the one that treated my mom. And I shadowed him many times. But I didn't go out chiropractor shopping to shadow. In retrospect, I think that would have been a wonderful idea. But I kind of had a one-track mind. Once I'd made up my mind and I really liked that chiropractor, he was like my mentor. Now, interestingly, you may find this to be interesting. The chiropractor that I shadowed was a very traditional chiropractor, one who only treated subluxations and thought he could treat anything by adjusting people's spines and fixing their subluxations. The I didn't turn out to be that kind of chiropractor, and I knew that I didn't want to be before ever going to Western States. In the intervening years when I was investigating different schools and different ideas, different paradigms of chiropractic, it became clear to me that I wanted to be more on the modern evidence-based side of things, and that's what drew me to Western States.
Great. So currently, what is the student to instructor ratio?
Currently, under current online class situations with the whole COVID pandemic, it's a little bit different. So I can tell you both. I can tell you that right now, in my cervical adjusting lab, we meet on Wednesday afternoons, and I have groups where it's me and 9 or 10 students. 9. Now, typically, when we're not doing online classes and we have all hands on, all systems go, we have one instructor and then TAs who are in the classroom. And what we strive for is a 1-to-8 ratio, one licensed chiropractor for every 8 students. Sometimes it ends up being 1-to-9, 1-to-10, but our goal is 1-to-8 if we can make it.
Great. And what is the most challenging term within the curriculum as far as you're aware?
Well, I'll tell you the ones that have the most challenging reputations. I know that 5th quarter and 8th quarter tend to be the ones that people talk the most about. Probably 8th more than 5th. They've moved a couple of courses around. I'm not sure 5th you see, but 8th is the one that tends to be the most challenging. And somewhere today, I'm sure when you talk to people, they're going to tell you about the split. Natasha, are they going to be talking about the split?
Well, we can mention it right now. So the split is the 8th and 9th quarters are sometimes challenging because that's when you first start treating the general public in our campus clinic. And also board exams come up around that time too. So some students decide to divide 8th and 9th quarter into 3 terms, making it a 13-quarter program total. So slightly over 3 or 4 years, depending on the pace that you go through it. But it does give you some breaks throughout the day so that you can study a little more or research your patient's medical history before coming up with a diagnosis and treatment plan. Yeah, just kind of gives you a little bit of freedom. Also, if you're doing the master's program concurrently, you might like that extra time too.
Good point.
Awesome. So let's see, one of the other questions we had, what is the best advice for preparation for the chiropractic program, like course preparation?
Oh, I love that question. And I can give you my answer, but my answer is kind of based on me and my strengths and weaknesses. I found biochemistry to be a really difficult course here at chiropractic school. I wish I had biochemistry experience. Now, as I understand it, and Natasha could answer this more authoritatively, but back in my day, my prerequisites were a little bit different than the prereqs today. I had to have multiple organic chemistry courses with labs. I understand is one of those now can be a biochem course. And if that were available to me, I would take it. But that's only because I found biochem to be a really hard class when I got here. Any head start to me would have been preferable. The other thing that I would really recommend is anatomy. And I know a lot of people come in here having had some kind of anatomy and physiology class, but your first year here, it's very in-depth and detailed beyond anything that you'd get anywhere else. So any head start you can have in anatomy would be a really good thing. Those are my 2 pieces of advice.
I would definitely agree with that. Our current students tell us that the first quarter biochemistry course that you encounter in the chiropractic program is one of the most challenging courses, but that's their favorite instructor, so they really love Dr. Williams. That said, our next question is, does the master's in sports medicine take longer to graduate?
Well, I can answer that briefly. You could expand on it, but no, you can take it concurrently so that on the day you graduate, you get both degrees, Doctor of Chiropractic and Masters of Science.
That's accurate. You're welcome to spread it out if you choose to, but otherwise you can complete both programs in the same 3-year period. And you would add on the master's about halfway through. So after 5th quarter, you can apply for the master's and start it in 6th quarter, basically adding a class or 2 to your schedule, quarters 6 through 12, and you finish both in the same 3-year period. Next question, what is your favorite chiropractic treatment and why?
I don't think I can actually answer that question. Oh, I don't know that I can answer that question. I as a chiropractor like variety. I like being able to use a lot of treatments. I guess if push came to shove and I had to check a box, what is my favorite treatment? It would be cervical. And maybe that's because cervical, meaning adjusting people's necks. And that probably is because in my own personal practice for many years, my area of specialty kind of ended up being headaches. And I spent a lot of time treating, adjusting, soft tissue work, stretching, etc., people's necks.
Let's see. Knowing that every job has its ups and downs, what are some of the challenges and downsides that you've encountered in practice?
That's a great question. And I think I could say without much hesitation, paperwork. And I think almost any doctor that you talk to will probably say that with the same lack of hesitation. The treatment part, the patient interaction part, that's just all wonderful. That's what we live for. It's the note-taking and the letters to the attorneys and the figuring out the billing codes. That is the headache part. That's the part that nobody particularly enjoys, but it's the price you pay for the rest of it that we love. You can't do it without that other stuff. Now, of course, when you have a busier practice, a lot of people employ others to do much of that for them. Now, nobody can do all of your paperwork for you. They can't sign your name as the doctor who treated the person, but they can do all of your billing for you and various things like that, your billing and your scheduling and other things.
Let's see. One more question. Are there certain milestones that must be achieved before progressing further in the program? For example, a comprehensive examination.
Okay, so there are a couple of places in the program, kind of midway to later in the program, where we have things like, they call them CSAs, Clinical Skill Assessment, where you do have kind of a high stakes exam where you have to go and perform things. Sit in a room, here's an x-ray in front of you. You have to read that x-ray, interpret it, and figure out what the diagnosis is. Then you come into a room which may have me in it, and I ask you, please do a cross-bilateral hypothenar transverse process adjustment to create right rotation at C3 or at T3-4. Okay, and then I watch you perform that. So there are some I can't remember the word that you used, kind of like a landmark exam, which allows you to then move further in the program. There aren't a lot of those. They come at kind of strategic points in the program, like when you are entering the clinical phase of your education. Natasha, would you add to that?
Yeah, the main thing I would add is just that if you live in the States, there's 4 US board exams that you also have to pass to be licensed as a chiropractor. And then in Canada, there's 3 additional exams that you would take there in place of the US board exams to be licensed in Canada as a chiropractor. So although we have different points throughout the chiropractic program to assess whether you're ready to go on to the next portion of the program, there's also exams in order to be licensed. And because of Oregon's broad scope of practice, there's an additional exam for the state of Oregon if you decide to stay local and practice here. Hopefully that helps.
To just make one quick clarification, your performance on board exams does not affect your progression through the curriculum at the school, right?
Right. And if you were to fail an exam, a board exam, you are welcome to retake it. So don't worry, come back, get a little more training if needed. But to be honest, our students typically score among the highest on the national board. So I would be surprised if our incoming students didn't do the same. One question that someone brought up, and I would like to answer before we go on to our next presenter, are chiropractors who graduated from University of Western States able to prescribe medicine? It's a great question.
It's a marvelous question, and no, they're not. Matter of fact, throughout the profession, that's a commonality among chiropractors. We don't prescribe medications. Now, depending on the state that you live in, like in the state of Oregon, under my license, I can recommend over-the-counter medications. Not all healthcare professionals are allowed to even do that. But one of the things that we like most about being chiropractors is that we don't prescribe medications. It's one of the things, the conservative care, that makes this job very appealing to us. We would rather have other people doing that and let us stick with the conservative care. Now, having said that, There are some exceptions to that rule, and one notable one is in the state of New Mexico. Now, you could probably look into this and get more information, but in the state of New Mexico, chiropractors who obtain some additional training can receive what they call the Advanced Practice Certificate, which allows them to prescribe certain medications relevant to the kind of things that chiropractors treat, namely things like muscle relaxants, anti-inflammatories, and analgesics or pain medications. Now, who knows? That idea is being toyed with in other states, and one day maybe it will spread to other states. Right now, it's kind of a test case going on in New Mexico.
Great, thank you so much, Dr. Partna. I really appreciate your participation. And
My
thank
pleasure.
you to everyone who provided questions. Those were fantastic. As I mentioned earlier, any questions that we weren't able to answer during this event will be answered via email to everyone who RSVP'd. Our next presenter is Dr. Jackie Bergstrom, who will be providing an overview of the clinic experience. Dr. Bergstrom has been a chiropractic physician at the University of Western States Health Center since 2018, when she decided to shift her focus from private practice to the instructional side of chiropractic. Dr. Bergstrom
We can't hear you, Natasha.
Thank you so much for letting me know. It looks like I cut out a little bit. So let me try again and just mention that our next presenter is Dr. Jackie Bergstrom, who will be providing an overview of the clinic experience. Without further ado, let's welcome Dr. Bergstrom.
You're muted, Dr. Bergstrom.
The one thing that we were supposed to do. Sorry, everybody. Welcome. Thank you to Natasha. And like she said, my name is Dr. Jackie Bergstrom. I'm one of the clinicians in the clinic, and I get the privilege today to give you a little overview of what that entails. I'm going to share my screen. I have a little PowerPoint for you. Okay. All right, this is what I'm going to be going over today. Just a little introduction, how you can become engaged starting in Q1, some of the pre-clinic coursework that you will go through the process once you get into clinic, and some preceptor and other opportunities that you have. When you begin as a Q1, you have complimentary chiropractic care for you and your family or significant others. You will make a list and give it to the front desk, and they will have that available. This includes chiropractic services, on-site diagnostics, lab work. Students receive 2 free pairs of orthotics every 2 years. You have nutritional support, rehabilitation, additional fees for lab work, and musculoskeletal ultrasound are also available. It's just also a great mentorship opportunity with an upper quarter student that you can ask about exams and courses, and then just to get to know your clinician and get to know the kind of the general process of the clinic and how you go through that. When you get into the pre-clinic in your upper quarters before, or upper terms before you head into clinic, you will have many shadowing opportunities. You can go local offices, you can come shadow us clinicians. You will have courses covering history taking, exams, diagnosis and treatment. You will learn our documentation course, which we use Epic as our electronic health record system. You will have coding and billing courses, and you will also have a ClinPhase series where you will work on simulated patients. Once you enter Q8, you will begin at the campus health center. We have 8 clinicians in my position. We have 4 in the afternoon, 4 in the morning. We treat all the US community, including faculty, staff, and students. We are open to the public and accept most major medical insurances. We have on-site imaging with the radiologist. We have both plain film and musculoskeletal ultrasound available. We also have some special relationships with some high schools, a returning vets program, and other opportunities for those. So begin in Q8, you start 2 days a week and it increases thereafter. By Q10, you will be required to be in clinic 25 hours per week. You have qualitative and quantitative requirements that we go through when you are treating the patients. You'll start where treating student patients of uncomplicated cases, and once your competency improves, then you will be able to treat outpatients and you can refer in patients that you will treat as well. These are some of the tracking requirements we use in the clinic. It's how you manage the patient charts, your performance of history, exam, and treatment. We have you perform management plans or write up management plans, excuse me. You also write up progress reports or referrals to other healthcare professionals. You will perform active care assessments where you'll give patients exercise to take home, and you will also have patient referral credits that you will need. When you get to Q10, you can start full-time rotations. This will be with another chiropractor. Dr. Daniel Delap is one that is at our East Clinic. And we also have a relatively newer clinical-based internship, which we call CBI, where you're placed with a chiropractor in the Portland, Vancouver metro area, and you will be with that during your clinic shift. We have partnerships with associations for part-time rotations at all, and these can be from 1 day a week to 3 days a week, depending on the need. The settings vary. Most patients are low to no income and have no insurance. Some examples of these are the Volunteers of America, DePaul Treatment Centers, Outside In, and Cascadia. Other clinical opportunities that you have, you can do private practice rotations. These you will go out and during your clinic shift or after you will go shadow another chiropractor. This can be one that you might foresee yourself getting a job with in the future, or just one that you like a certain technique or a certain multidiscipline area that they have to kind of get a feel of what that is. OHSU also has a chiropractic clinic in Q11 or Q12. You can interview for that. The Medical College of Wisconsin in Q12 also accepts interns. And then we have multiple locations around the US where the VA clinics will take on a Q12 student and you will do your internship, the rest of your internship there. So once you've reached either all your requirements for Q11 or mainly Q12, you can do a preceptorship. This is where you will, usually in Q12, you don't have any classes, so you spend all your clinic time with this. Oftentimes, it's somebody that maybe you're going to eventually practice with, or it's just somebody that you know that you can get a new experience with. These can be anywhere across the States and in Canada. So it's a great opportunity to just get a new feel for a practice routine. And here is a few photos that I have for the new clinic. This is our reception and front desk area. This is one of the treatment rooms. There's all similar. This is our fitness and rehab room. We have access to that. You have access to the fitness room as a Q1 as well. And this is our lab that we have on campus. So welcome to the UWS. I look forward to seeing you all in the halls of the Campus Health Center.
Great, thank you so much, Dr. Bergstrom. We do have a few minutes for questions, so if anyone would like to ask Dr. Bergstrom a question about the clinic experience, please go ahead and post a question by clicking on the Q&A button at the bottom of the page and toggle to choose if you would like to include your name or post the question anonymously. To begin, Dr. Bergstrom, what is the biggest challenge that new student interns face starting in the clinic?
I think the biggest challenge that they have is just first getting the flow, kind of putting what they've learned into actual doing it, doing a history on a real patient, doing an adjustment on a new patient, and learning, getting that and learning the electronic health records and putting everything that you've learned into one visit.
Great. Are students able to perform x-rays and ultrasound in the clinic? Sorry, did you hear me? Are students able to perform x-rays and ultrasound in the clinic?
So you're breaking up a little bit, but I feel like I got that. Are the students able to perform x-rays and ultrasound? Pardon?
Yes, that's right.
We have a little unstable connection here.
Oh no, that is correct.
Sorry
though.
about that.
No worries.
Okay,
That's
I
right.
think we're good. Students will observe the radiologist. The radiologist, we have two, kind of 2.5. One's actually on their way out, but radiologist interns that will take the x-rays. We also had a radiology tech that was with us. He just retired. So they will take the films, but they want you a part of that also, to watch them. Eventually, sometimes maybe they'll let you hit the button or whatever, but they pretty much guide you through the setup. And sometimes you can help out on that, patient positioning, things like that. Great.
Our next question is, if a student wants to do their preceptorship in Canada, do you have resources to find DCs in Canada, or are the students responsible for finding a chiropractor to work with?
You can do either. We do have some preceptors that are already approved. They have to go through an approval process with this. So we have an admin staff that takes care of that. You can meet with them and they will give you a list of current chiropractors that are approved on a list that you could preceptor with.
Great. Let's see, are there partnerships with specialties in the area, or can you find your own not partnered? I'm guessing that they mean if we want to work with specific populations or with a chiropractor who focuses on a specific area like neurology or sports medicine. That would be my guess. Sorry, did you hear me?
That's yep. We don't maybe necessarily partner with them, but you can definitely shadow any of those. And you can go, the Sports Masters is a great one. If you're in that program, you'll go to, you know, games and whatnot, and you'll learn from the chiropractic sports physician for their neurology. We have a great functional neurologist that a lot of people like to shadow and follow, and there might be preceptor opportunities for that. We don't necessarily partner with those, but we can provide shadowing opportunities for that.
Great. And let's see, how often do students treat patients with comorbidities?
Once you become competent, you know, we'll have an upper quarter intern probably treat those, but you know, it really varies. Oftentimes it is, you know, they'll have a comorbidity of, you know, arthritis or diabetes or increased blood pressure. You know, we may have to work with their medical doctor in, you know, what are they doing for diet? What's their plan for their prescription for these? So yeah, we will see them. How often, it just varies.
Great. Well, thank you so much, Dr. Bergstrom, for that overview of the clinic experience. Our next presentation is a panel of 3 students and 1 alumni of the university here to tell us about their personal experience in the program and in practice. To get started, I'll ask each of the panelists to tell us their name, where they're from, and what quarter and programs they're enrolled in. It looks like their screens are just getting turned on, so I'm just going to mention that our panelists are Victoria, Kieran, Caitlin, and Jaime. So to get started, please let us know your name, where you're from, and what quarter and program you're enrolled in. Victoria, would you like to start us off?
Hi guys, sure. Thanks, Natasha. I'm Victoria. I am actually from Canada. I'm from a small town called Fernie, BC, about 3 hours out of Calgary. I'm in quarter 11, and I'm also doing the sports med program. Do we say the next question, Natasha?
No, it's okay. You can hold off.
Okay.
Let's see, Kieran, I think you're next.
All right. Hi, everyone. I'm Karen. I'm in quarter 6. I'm also from Canada, from Surrey, BC, so not too far from Portland. Yeah, I think that was all the questions. Perfect.
And Caitlin?
Yeah, I'm Caitlin. I am in quarter 7, so about halfway through the program. And I'm from basically DC, from the East Coast, from Virginia. So.
And Jaime, our alumni.
Hi, I'm Jaime Medina. I graduated from UWS in 2018, and I have practiced in the state of Washington, and I'm currently in the state of Oregon.
Great. So let's go in the same order, and can you please tell us what has been your favorite class at UWS and why was it your favorite?
Sure. So that's me. I'm pretty much almost done the program, so I've had tons of classes. The one that really stands out to me was in quarter 6, and that's kind of when it all started being really real that, oh my goodness, I'm going to be a chiropractor, was spinal disorders. It was one of the hardest classes I've ever taken, but it was also the most rewarding.
Perfect. And just feeding off that, I think I really enjoyed spinal disorders as well. But in quarter 4, I had rehab principles, and I thought that was a great one. We learned like all different things about stretching, all like lots of ways to stretch a different muscle, lots of trigger point work, even some instrument assisted soft tissue work. So I think that was a really fun one, and I think that's stuff that I'll incorporate into my practice every day. So it was nice, that one.
Yeah, my favorite was neuroanatomy and neurophysiology. I thought that was just a lot of fun, just because you actually get to see real brains, as well as learn more about pain receptors, which kind of helps you understand chronic pain. And it just was really relevant, but really, really interesting. And Dr. Major is amazing. Like for the anatomy portion of it, it's basically like a fun coloring class, but it's actually really, really helpful for you to understand all the different nerve pathways and everything. It's a phenomenal class.
Thank you. And Jaime, what class was it for you?
For me, overall in general, it was the whole gross anatomy courses that we took that first year. It was a very, very good intimate view into the human body, because you got to dissect human bodies. You know, you will go through the course and you will have a lot of plastic models of spines. You will look at a lot of drawings and netters and in books. But this really, really puts in perspective how the body works and how we can actually help it. And getting your hands on somebody like that is a very, very special situation that not many people can have.
That's a really good point. Finally, I have one last question before we open it up to questions from the audience. So while attending UWS, which clubs did you join and what did you learn from them? And then also, are there any that you would recommend?
So clubs, I was an anomaly. I didn't really join a whole bunch, but I highly recommend all the adjusting clubs and the rehab to performance ones. I did join sports med because of the masters that I'm in, so that was a great way to just practice skills and stuff. And then there's tons of sports and rock climbing and stuff, all those clubs. I joined a couple of them and they were so much fun. It's just nice to socialize outside of schoolwork and dissecting and adjusting.
Yeah, I think I would agree. The adjustment clubs are great. That one I have been going to for quite some time. It's really nice, as Victoria said, to socialize kind of outside your cohort as well. You meet a lot of different people from different quarters, and learning from your peers is also just great in a different way. So I think that one is the great one.
Yeah, definitely. As I mentioned, I started clubs really early on, which I found really helpful because I got to meet a bunch of upper quarters. So with our iPads and everything, you get airdropped a bunch of resources, which is really, really helpful, all the study guides and everything. But personally, of all the clubs that I've been part of, I really loved Soft Tissue Club. We don't get that much soft tissue work since it's chiropractic. We do a lot more adjustments. So that club is so fantastic because they do a lot of ART and myofascial release and Graston. And so they bring in a bunch of different techniques, which I think is just really, really helpful to have that extra reinforcement. So.
Good point. And Jaime, what did you enjoy when you were at UWS?
It was interesting because to back everybody up, the adjustment clubs were amazing. They really, really do help you kind of honing your skills. But Victoria did mention something, and Keelan, I believe so, about socializing. There's a lot of social clubs out there. There was a soccer club that I was part of. For a moment, I was also part of the gardening club that we had going on the campus. That was really fun. I got to learn a new skill there. I ended up using it living in rural Washington for a year. It was, so you get to learn a lot more than just chiropractic. I'll tell you that much. Everybody has a little bit to offer.
That's great. So now we'd love to hear your questions. If you'd like to ask our panel a question, please go ahead and post it by clicking on the Q&A button at the bottom of the page and toggle to choose if you'd like to include your name or post the question anonymously. It looks like we have quite a few that have come in already. So let's see. For the Canadian students, did you find the admission and transition to an American school challenging? Also, was getting financing challenging?
Do you want me to answer that one, Natasha?
Sure, thanks, Victoria.
No worries. So it was a bit of a culture shock, just moving from Canada to the US in general. And in Portland, like, I don't know if many of you know this, but you can't pump your own gas. You can right now because of COVID. But I got yelled at my first time. So if you guys have any issues, and you're Canadian, don't hesitate to reach out to Kieran and I. We have tons of tips and tricks of transitioning. I wouldn't say necessarily it's from a Canadian school to an American school transition. It's from undergrad to graduate school. It's the amount of volume, the amount you're in school, like you are immersed in it and it's your whole life. So that's what was challenging, was taking that transition and getting used to the speed of it. And financing wasn't too bad. They have the CIBC professional line of credit. You will probably have to get a co-signer, which you'll have to talk to your parents about, or your spouse or whoever you're with, unless you are an adult already and you have figured out your life, which I have not. And also government loans do recognize UWS for the provincial loans and such. So there is funding, it's available. Anyone else to add, Kieran?
I think you hit all the points. Yeah, the CIBC and then the government loans were, yeah, it wasn't too much of a struggle for those. And then I think you said it with the transition, it was mostly from the undergrad to the graduate school.
And I would add, if you are moving down, to definitely look into getting an American bank account. It's not super difficult to get. You just need your passport and your visa that Natasha will send you whenever you're coming down. And they set you all up, and it's really easy to transfer your money down as well. So you can pay for rent and food and whatever else you need. It's just an easier way to manage your money.
Great. Let's see, our next question is, I'd love to know what considerations you had when looking at chiropractic schools, and what was it about UWS that other schools didn't offer? Does anyone want to tackle that first?
I can do that. So I actually visited a number of different schools. Coming from the East Coast, I didn't know if I wanted to move to the Pacific Northwest, even though my chiropractor at home highly recommended UWS, but he also recommended other schools. So what I would recommend is honestly checking out all the ones that you're interested in, talking with them. What really brought me to UWS was not only the reputation and their board scores and everything, but also just talking to current students and the faculty, like actually at preview day. I really liked the vibe of the school. I thought that everyone was so friendly, and I liked that it wasn't just about the academics for the student body, that the students seemed really social with each other outside of school. And so that was a big reason why I chose UWS, because everyone just seemed like they were more part of a family than part of a school.
Does anyone else have anything to add before we go on to our next question? No? Okay.
Just to back up what Caitlin said, you do feel very much like a community. I was looking at other schools as well, and as a Canadian, I was looking at CMCC, which is a very good school, don't get me wrong. But for me, it wasn't necessarily it was considering the academics, and they're pretty much at par, but for me, it was the lifestyle that I chose. I liked the community that UWS had. I liked the classes, and I love the professors. Like, everyone knows everyone cares about, how you're doing and everything. Like, Dr. Bergstrom was one of the main people to help me with my adjusting, and she went out of her way, and that's the norm. And I when I came down to do my tour and everything, like I asked Natasha so many questions, but that's what you get your whole experience. And I found that really important, especially when you're in such a hard program, to have that support. And it's not just like your family that's supporting you from a distance. It's there, it's at the school for you.
Great. The next question, I think Jaime might be the best person to answer. So for non-traditional students, how do you balance school and family life? Can you give an example of what your typical day or week looks like in terms of class time and workload, homework time?
Okay, so that was a difficult situation. I came into school with a family. I had a wife and I had one child. Right in the middle of school, we had a second kid, and so that made it a little bit more difficult. So the way I balanced my school and home life was basically school was usually over by around 5 p.m. or so. I made it a conscious effort to stay after school about 2.5 hours. So I usually left campus around 7:30 at night. But when I got home, it was a complete change of mode. It was school mode was over, and then family mode came alive. So when I was home, I paid attention to my wife. I paid attention to my kids because they also had needs during that program, especially because it's pretty rigorous. So that's the way I ended up balancing my home and school life, and it worked out pretty well for me. Weekends, I kind of split it a little bit in half just because you do have quite a bit of coursework and you sometimes need that little bit of extra study time. But just one thing is just to make sure to take care of your spouse and your family, because even though you are the one that's going through the coursework and you have to sit there and study and they will see you stressed and out, they will feed off that energy as well. And your wife and your spouse and your kids will also be like that. So make sure you take time to make sure that they're happy as well. And what I did worked out well for my family, and I hope that's helpful for you.
Great. The next question I think you can probably all answer, so maybe we'll go back to the round robin we had before. How did you find housing, and did you live by yourself or with roommates, and what would you recommend?
Actually, Natasha helped me a lot because I asked her a lot of questions. And I used the UWS housing links. We do a survey kind of every other year about where all the students live and the management, if they're used to having us and stuff. So I did it that way. Coming down from Canada, I called a lot of places. I Googled mapped everything to see how far everything was, what the streets looked like and such. I live with a roommate. I'm very lucky that she came with me from undergrad. So we've been living together, which is great. And I think it just depends for my recommendation about what kind of personality you are and what you're looking for. It all just depends. Depends if you have a family, depends if you're used to living by yourself, if you're used to living at home. It really is, there's all options for you.
Yeah, I kind of lucked out here. My brother was actually already in the program and he was already a year in. So I lucked out and I kind of just moved in with him and it was all set up for me. But my recommendations now would be to either contact one of us and we can always give you recommendations, or Natasha posts great links on the Facebook pages. So I think those ones are great to look into. And I would probably look into the ones that are common for the UWS students. So yeah, Natasha has great links and I would look into one of those, I think.
Yeah, I ended up finding, so I have two roommates that I found via the Facebook group, because when you say yes to UWS, you get put into a fall cohort or winter cohort Facebook group, so you can kind of connect with your future classmates. So I found my two roommates through there, and then we ended up renting a house right around the corner from campus that we found on Zillow. We ended up having like the like rental agency give us not a Zoom, but like a Skype tour of it, and it ended up working out really, really well for us. So I really like that option for me. So
For us, the admissions office did have, like, they had a folder at the time. I don't know if you still have it, where there's apartments or housing or people who are offering rooms for the students are able to look through. And that's how we ended up finding our apartments. For myself, it was super important. The mode of transportation, I was able to go to school. My goal was that I needed to be able to bike to school, and we found an apartment complex that provided that opportunity. So I bike to school every day. It was like a 10-minute bike ride. It was great. My wife and the kids ended up having the car. Another great resource that I'm seeing a lot lately is the UWS switchboard. If you ever look into that, there's always other students or kind of looking for roommates, like a lot of people here. There are also, I feel, apartment complexes and managers have been given access to that as well, and they'll put up like little announcements saying like, hey, there is this apartment available. They could be near campus or anything like that. So right now, for a prospective student, I would recommend UW Switchboard and go ahead and look at those pages. It's a really good resource.
I agree with that. And just to give everyone a heads up, unlike other US cities, in Portland, housing turnover happens every month. So I would kind of start looking at apartments around the beginning of the month as things get posted and choosing something towards the end of that month. They turn over pretty quickly, but it's not like they all switch over at the same day every year. So just kind of keep an eye on the ones that you're interested in. The next question is also for everyone. Is there something you wish you'd known before starting chiropractic school? So following the same order.
What if I don't have an answer?
And tag Kieran.
I'm tagging you and come back to me.
I guess for me, I would just say being prepared for how busy it was going to be. I think if I had known that, maybe I would have taken a little bit more time off after I finished school, kind of got things done that I don't necessarily have time for anymore, I guess. So yeah, I think if I had known how busy it was, I would have taken a little bit more time to get started in the program.
Yeah, definitely. As Karen said, the program kind of starts off a bit crazy. It's a lot. For me, I'm a second career student. So my undergrad was actually in political science, and my science course was Rocks for Jocks. So I had to go back and do prerequisites. I highly recommend anatomy. Like if you want to brush up on anything, know your origins and insertions, know like pathways of nerves and blood supply. That will save you so much time your first quarter. And I wish I would have done that more. So that's definitely one that I would recommend.
I'm going to reiterate a point that Dr. Parna made earlier when they was asked this question. You know, one thing I would have liked to know is how diverse chiropractic actually is. My first exposure to a chiropractor was a doctor who practiced the Gonstead method. That was my chiropractor. I didn't know what he was doing. I just thought, hey, he's my chiropractor. Sure, you know, he's doing a good job. When I got to school, then I got introduced to all of this. I remember one class that, you know, we were going to partner up with another student, and, you know, we got to pick a system and wrote a report on that particular system. That list was really long. And so that's one thing that I'm going back to the point Dr. Partner made. Make sure you shadow doctors. You know, I know a lot of people will come in with, like Dr. Partner did, I'm already set on the doctor. I already know what I want to do. I already know where I'm gonna go. Expand a little bit on that, because you'll be surprised what you can do with chiropractic. So that's gonna be my point. You know, I wish I knew a little bit more about the techniques and the options that we can do. It's not just going into an office and adjusting people all day. There is a lot that you can do with a degree.
Great, thank you. This question is for anyone who feels comfortable answering it. Are any of you completing the program in 3 years instead of 4? And what are the benefits or drawbacks of completing in these 2 timeframes?
I can start. I am completing it in 3 years along with doing the master's program. I think the benefit is you get it done. You don't take 3 months off because every quarter builds on itself. So you don't lose any practice. You don't lose any of the information from the past quarter to apply to the next quarter. The drawbacks is you only get 2 weeks off every 11 weeks. So it's pretty draining and stressful by the time you get to your week break or your 2-week break. But there's like, if you want to take the summers off, highly recommend it if you feel like that's what you need to do. But if you feel like you can push through in those 3 years, it's awesome. It's exhausting, but it's amazing.
Anyone else?
Oh, sorry.
Go ahead, Hami. You're good.
All right. It's so polite. I like it. I completed the program in 3 years. It was a lot of factors through it. One of the main ones, just because I had a unique position with my family. You know, I was like, do I really want to, put my family through a 4-year program along with me? And my answer was obviously no. So I went through summers, and summers are a little bit slower. Do have a lot of students who take it off. But overall, I actually really enjoy the summers because of that situation. It made the classes a little bit smaller. It made it a little bit more intimate with the professors that were there with you. And I felt like I got a little bit, just a tiny bit more out of my summers than like the full-on quarters as well. So that was a really good up for that. But just like Victoria said, it is stressful, and yeah, you just kind of have to kind of push through it really.
Yeah, definitely what they said. I would say I'm also not taking summers off, so I'm doing it in the 3 years. I think most people don't take the summers off. I think the majority of the students do go through it in the 3 years. The nice option is when you are in 8th quarter, you can take the split, which is where it only extends your schooling by 3 months instead of a full year. And that way, I know a lot of my friends are doing that just to have a little break. And if you start in the fall, 8th quarter lands over the summer, which works out really well for them. So.
Thank you, Caitlin. That's a good point. Yeah, so I would say about 97% of our students do it in 3 years. So what our students have said in this panel is not uncommon. It's actually the most common option. It's pretty rare for people to take summers off. So let's see, there is one more question I wanted to ask everyone. Let's see, are students able to work and make a living during their time in the DC program, or do most students rely on financial aid to pay rent, groceries, etc.?
Go ahead.
Okay. I wouldn't say make a living as an option. You can make a little bit of money on the side to pay for groceries and such. I work for the admissions office. I get to send you guys all the fun emails and say, hey, how's life? And so I do rely a lot on financial aid to be able to get through the program.
Same. The program it's exhausting. I've known a couple people who've had jobs outside of the program of where they're, bartenders or so forth, but it's very, very minimal hours, and they do that just because it's flexible. The nice thing, because as I'm sure you've heard from all of us, the program is very long and exhausting and can be overwhelming at times. So when you have the free time, you don't necessarily want to work. So for me, for my mental health, I didn't even work on campus until this quarter. Now that things started to calm down a little bit in quarter 7, I started working on campus in the marketing department. So, and I feel like that's been really helpful. And that way I'm still working on a skill that I can use later on in life. So, but making a living to, pay for everything would be really, really difficult with the program.
And I'm just going to add one quick note, which is that Canadian students are allowed to work on campus up to 20 hours per week, but if you're Canadian, you cannot work off campus at all. And what our student panel has said is pretty accurate, that students typically will take a job, maybe working as a massage therapist or something at the beginning of the term, taking a few shifts, but then not doing any near finals at all. So you really need a very flexible job or to just not work and be focused on the program. One last question I wanted to ask Jaime before we move on. Jaime, since you're the only alumni on the panel, can you please tell us about your experiences with finding and joining a practice?
My experience, as soon as I started school, I made it a very good effort to, once again, to go out and job shadow, because you really want to zero in on the type of practice that you want to be a part of. There are so many out there. There are general chiropractic practices. There are sports and rehab chiropractic practices. There are doctors that concentrate on PI, personal injury, and there are doctors who go out and are professional witnesses in court cases. So you have to kind of really explore the gamut of it, and the best way is to go out there. My first practice I joined was in rural Eastern Washington in a town of 3,000 people. And the reason I joined that practice is because I'm bilingual. I speak English and Spanish. And out there is a great need for Spanish-speaking doctors. There's a lot of fields, there's a lot of orchards, there's a lot of very hard manual labor work in that sense. And I felt that I could be a really good asset for that. And so that's how I ended up choosing. So kind of assess yourself and what can you bring to the table. What basically makes you a worthy person for these people to go to, and kind of let that kind of guide you. That's what I ended up to me, and it really took me to this place I never thought I would be, which is in a rural community. It was a great experience, and now I'm currently back in Oregon. It really helped me kind of bring that experience here with me. So I do have some Spanish-speaking patients here as well. But yeah, in reality, figure out where you want to be and then start looking at your options for that particular niche, you could say.
Great. Thank you, everyone on the panel. I greatly appreciate all of your input, and thank you to our audience for your questions. If you'd like to connect with a student ambassador after this event to ask additional questions, simply email studentambassador@uws.edu, and Victoria or Kieran will be happy to respond. So Canadian students, we have you covered. Our last presenter of the day is an admissions advisor from the Office of Admissions, Riley Lakos, and they're here to speak with us about the chiropractic program prerequisites. Again, we'll leave time after the presentation for questions, so please join me in welcoming Riley.
Hi, Natasha. Thank you so much for the introduction. As she mentioned, my name is Riley. I'm one of the admissions advisors for the Doctor of Chiropractic program. I have some slides prepared for you, so I'm going to go ahead and share those. We're going to go over the program prerequisites, but I also have a little bit of information on admissions, financial aid, and some coronavirus resources. So let's go ahead and start talking about prereqs. We do ask that folks complete a minimum of 90 semester credits, which is the equivalent of 135 quarter credits. Those are going to be spread out. It usually takes about 3 years to complete those credits of about a 4-year degree, but you can complete those credits at a community college or at a university, so long as the school that you're taking the classes through is regionally accredited. You'll also be aiming for at least a 3.0 GPA on a 4.0 scale. And those courses that you're taking are going to span the life and physical sciences, humanities and social sciences, and additional credits. So first, let's talk about the basic science requirements. That's going to make up 24 semester or 36 quarter credits of the overall total. The requirement is that they are 100 level science credits or above 100 level. If you've taken college prep courses or remediation courses, those are typically below level 100, and we would not be able to accept them. Half of the classes that you take for the sciences need to include a lab. It's highly recommended that you take 200 level science courses or above. That's because of the content that is in 200 level or above courses is typically deeper content, and more preparatory for this kind of program. While it's not required, it is highly recommended that you do full year sequences in each science category. We will accept if you take just like one class in a science category, that's okay. Though we do recommend the full year sequence because then you'll get the full content distribution. We recommend as well that you take classes that are for science majors. There are a lot of science classes that are not for science majors, and it'll say that in the course description. And so if you're taking the science classes that are for science majors, they're going to, again, have more content for you. We recommend as well that you are on a pre-med or pre-health track. Some colleges will also have pre-chiropractic tracks. That will ensure that you're taking a lot of science classes, and also you'll probably be working with an academic advisor who can assist you in further course selection. Beyond the sciences, there is also, well, first let's talk about biology. Within the science courses, there's going to be the biology requirement, and acceptable courses for that include general biology, cellular biology, microbiology, molecular biology, human biology, genetics can also count, anatomy and physiology, all of these courses taken with labs. You can take a combination of those courses as well to count toward that requirement. Another science requirement is going to be chemistry. That's split up into general chemistry as well as organic chemistry. Earlier in this event, Dr. Partnow was talking about the biochemistry course as being an option. You can take biochemistry in lieu of organic chemistry, so instead of organic chemistry, if you would rather do that. And the University of Western States does offer an online biochemistry lecture class every quarter as a prerequisite course that folks can take if they still need to take that class to meet that requirement. Lastly, we have physics and related studies. Generally, people are taking a physics class specifically. However, you can take other courses instead of physics. You could take biomechanics, statistics, exercise physiology, or kinesiology. We would want to review the course descriptions for these classes because it just depends on the school and the content of the class and whether or not that's going to meet the requirements. In general, you're welcome to connect with an admissions advisor to talk about the specific classes you've either taken or courses you are planning on taking to make sure that whatever the content of that class is meeting the requirements that we're looking for. So outside of the life and physical sciences, we're also looking for humanities and social science credits. This ensures that our students have diverse academic backgrounds. This can include courses in content areas such as writing, English, speech communication, sociology, psychology. If you wind up taking other classes like business classes or math classes or even more science classes, those will get lumped into additional credit to create that overall 90 semester credit or 135 quarter credit total that we're looking for. Some additional notes just based on the information that you've been receiving today. Students can earn a Bachelor's of Science in Human Biology after their first 5 quarters of the DC program. This is not a traditional undergraduate program in human biology. It's combining the courses you took for your prereqs with courses that you're taking in those first 5 quarters to complete a Bachelor's of Science in Human Biology. This can be particularly useful for students who want to take one of our master's programs. We talked a lot earlier about our sports medicine program. About a third of our chiropractic students are enrolled in that program, but in order to be eligible for that program, you do need a bachelor's degree. And some students come to us already having completed a bachelor's degree, others have not. And so having this Bachelor's of Science in Human Biology will allow you to apply for an additional master's program if you wanted to do that. Another thing to note is that students can apply for the Doctor of Chiropractic program before they finish their prerequisite requirements. It means you can submit your application when you're still working on your classes. We do ask that all of your courses are completed before you start the program. We usually are looking for students to submit their final grades a couple weeks before the term starts. So that's kind of the timeline that you would be looking at. But you can apply when you're still working on your classes. Lastly, I wanted to point out that we are aware that a lot of universities, because of COVID-19, have transitioned from a graded course format to pass, no pass credit. I'd say as an advisor, this is probably one of the most common questions that I've been getting from prospective students about applying to the chiropractic program is if we will take their pass, no pass credits. And the answer to that is that we are aware of this. We're going to be practicing as much flexibility as we can. It's going to just depend on each individual situation, what courses you took for pass, no pass, how many credits you have that are pass, no pass. What we were asking people to do is in the application, there's a section for prerequisites, and it's an optional section. Not everyone has stuff to share about their prerequisites, but we ask that if this situation applies to you, that you put that in your application in that section, that you are currently receiving pass, no pass credits due to COVID-19. All right, so next steps for applying, if you haven't already applied, if you have questions about your own specific situation, like we're going to have a Q&A after I finish this, but if you do have questions that are more specific to you, we do recommend setting up an advising appointment with an admissions advisor to go over those questions. When you're ready to apply, you'll submit an application online. It's an online application with a $50 application fee, and it includes 2 essay questions that make up your personal statement, 2 letters of recommendation, an uploaded resume, official transcripts from regionally accredited colleges, and then an additional note for international applicants. This does not apply to Canadian citizens who have completed their college in Canada. So for other international applicants, there is an international credential evaluation that we require for transcripts from international universities. Now, if you're a Canadian prospective student and you completed your college experience in a different country, then that would be required of you. Additionally, for students who are not from the US or Canada, you may be required to submit a TOEFL score of at least 80, depending on the languages of your country. So once we receive all of this application material, all of which can be found online on our website, we'll review your application and reach out to you about scheduling a personal interview via Zoom as a video conference. For students who then get admitted into the program, we do ask for a $300 tuition deposit. This is not an additional fee. It goes toward your first quarter tuition, but it shows commitment to attending the university and holds your spot in the cohort. Additionally, for admitted students, we have a background check requirement, though the university covers the cost of that, so you wouldn't have to worry about paying for that part. I want to briefly touch on financial aid. United States citizens or United States students can apply for federal financial aid by submitting a FAFSA using our school code, which can be found in the FAFSA application. It is on the slide for folks who are calling in on a phone. That code is 012309. Canadian students can apply for loans and grants through their province by entering our school code. Also on the slide, M as in Mary, W as in Walter, L as in Lion, M as in Mary, and our program code, which is T as in Tom, A as in Apple, I as in Igloo, 7. In addition to federal or government aid, we do have scholarships available through UWS. We have 4 scholarships for incoming students, and students can apply for up to 2 of those 4 depending on your eligibility. That information can all be found on our website, but if you're applying for or had been admitted to the fall 2020 cohort, those scholarship applications are going to be due on July 10th. And if you are applying for or admitted to our winter 2021 cohort, those applications are due October 9th. The applications, eligibility requirements, all of that can be found on our website. And if you have specific questions about financial aid, we highly recommend contacting our financial aid department directly to have a conversation with them about your specific questions and situation. And you can contact them at FinAid, it's FINAID at uws.edu, or at 503-847-2563. Their contact information is also on our website. Right, so I'm going to just touch briefly on some COVID-19 resource information. As our Executive Director of Admissions, Josh Civiello, mentioned at the beginning of the event, our hope is that new DC students starting this fall will take all of their courses and labs in person on our Portland campus. In the event that there are still COVID-19 restrictions, the university is prepared to offer the full curriculum virtually. We're closely monitoring the situation and have developed plans to help us navigate the possibilities. In addition to that information, we do have a frequently asked questions page, and the information on the next couple of slides comes directly from that page on our site. A lot of students are wanting to know, how are we working to keep our students and employees safe? We are encouraging social distancing on campus and limiting the number of people on campus, increasing sanitation and cleaning schedules. We're canceling non-essential travel, meetings and events, moving things to the virtual platforms as we can. We're modifying work locations and schedules for employees and transitioning. Our spring 2020 term has been fully transitioned into an online environment. Some other frequently asked questions include, will extensions be allowed for final transcripts and other application materials? We will be flexible and work closely with students and schools to ensure that we have the documents that we need without creating additional stress for our applicants. That being said, we also do encourage everyone to apply as early as they can and request their documents as early as they can. You can often just request your transcripts be sent to us through the registrar's office website of the school that you attended. And so if you're having any issues with that, please communicate with us as soon as possible. Another question that comes up is, my current school closed. Will you accept an unofficial transcript? And we can accept unofficial transcripts to make preliminary decisions, but final decisions regarding enrollment at UWS are contingent upon receiving a final official transcript. And even if your school has closed or if you're having issues getting a hold of your school, they should be able to provide you with an official transcript, or at least be working on developing processes to issue official transcripts to students. Are you processing applications? And yes, the admissions office is still processing applications, conducting admissions interviews, and notifying students about their admissions decision as we normally would. Please contact your admissions advisor directly if you would like to discuss your application, elements of your application. If you're waiting to hear back about your application and you're wondering how that process is going and where it's at, you can definitely reach out and give us a call. If you wanted to keep up to date on frequently asked questions like this, I highly recommend going to our website. uws.edu/coronavirus-resources is going to have all the information that you would probably be looking for in regards to coronavirus. All right, and with that, that is the end of my presentation. I'm going to pass it back on to Natasha so that we can have a bit of admissions Q&A. Natasha?
Yeah, thank you, Riley. If anyone has a question about the program prerequisites, please go ahead and post your question by clicking on the Q&A button at the bottom of the page and toggle to choose if you'd like to include your name or post it anonymously. To get started, one question I had is, I'm not sure if I've fulfilled all the requirements. Is it possible to have my transcript evaluated before I apply?
Yes, it is. So I would recommend getting in touch with our admissions office. You'll be put in touch with your specific admissions advisor, and we'll be able to complete an unofficial transcript evaluation. But you'll want to keep in mind that because it's an unofficial transcript, it is an unofficial evaluation of your transcript. The official evaluation will take place once we receive that official transcript with your application.
Great. And how much weight does the interview have for being admitted into UWS?
It is a required part of the process, and you have to get through that part of the admissions process in order to move on to the final application review and the university decision. We do practice holistic application processing, so while every element of your application carries weight, we do look at each individual element of your application, and we're looking at your application as it stands on its own. We're not comparing you to other students.
Great. May you expand on the application essays, please? When do we receive the essay questions, and is there a specific criteria?
Yeah, so the essays are embedded in the application. So once you start an application, you'll have access to those questions and the fields for submitting them. But one of them is on your career goals, and the other one is on your extracurricular activities. The career goals, when you're kind of talking about what you want to do, what kind of chiropractor you want to be, and how our program is going to help you get to where you want to be. The extracurricular activities essay, that can be volunteer experience that you have, clubs that you've been involved in, sports that you've played. It can be things you're doing now, things you did some years ago, things you did in high school. I've read a lot of different kinds of essays, and the important thing is just to highlight things that are meaningful to you and connecting it to like your decision to pursue this kind of career path. One important thing to know about the essays is that each of them are 250 to 500 words a piece, and they each have those word requirements. So when you're writing that, we typically recommend write that out in a Word document and use the word count feature to keep track of how long your essays are and save them, and then you can copy and paste them into the application.
Great. And when do you conduct interviews after an application is submitted? And after an interview, when will admissions decisions be made?
Yeah, so what the process looks like is we receive your application. It goes through an initial application review by the admissions advisor. We pass that on to our admissions committee. We reach out to you about scheduling that interview. And then after the interview, there's a final review of your application, and then we get you a university decision. That whole process, like in just my experience as an advisor, can take like about a month to a month and a half to get through the whole process. But it also just is going to widely depend on your application and if we're missing any materials, if we have any follow-up questions, if you're currently taking classes and we need more information about the classes that you haven't taken yet, that might impact the time frame. But that's generally the length of time that you'd be looking at.
Great. And one last question. Do letters of recommendation from chiropractors carry more weight than others?
Your letters of recommendation are going to carry more weight if they are good letters of recommendation. It is less important about like who is providing your letter of recommendation and more about how long they've known you and how well they know you, how well they can speak to your strengths and ability to be successful as a chiropractor or in graduate school. So we're looking more for that kind of content than the specific kind of people that you're asking to be your references.
Great. Thank you to everyone who posted those questions. And thank you again, Riley, for answering the program prerequisites. And to our attendees, thank you so much for joining us today. If you have any lingering questions about the admissions requirements, application process, chiropractic curriculum, or anything else, please email admissions@uws.edu and your advisor will make sure to connect with you. Take care, and we hope to see you on campus soon. Bye.